There are new CDC guidelines for COVID-19 testing. To get you caught up on that and other coronavirus headlines, let's bring in Dr. David Winter from Baylor Scott & White. Good morning. Good to see you.
Good morning, Sonia. Good to see you.
Thank you. So I do feel like this, the new guidelines, it was sort of a story that got buried between the hurricane and politics. Can you just get folks caught up on that? Because I think there's confusion now. When should I get tested? Do I need to talk to my doctor about this? What should they do?
Well, in an ideal world, Sonia, we'd have a lot more testing available. We'd get a test anytime we thought we were exposed, but this is still a concern. There's not enough testing out there right now. And so what the CDC is saying that if you have been exposed, if you have mild symptoms, you don't have to have a test. Just stay away from folks for 10 days or at least 2 days after the last set of major symptoms or 1 day after the last temperature elevation, and then you're okay. That works for some. Now, I would say folks that have other comorbidities, chronic lung disease, chronic heart disease, chronic kidney disease, any immunocompromised condition, those folks need to know early because we want to watch those very, very carefully. For folks with milder cases, younger folks that are healthy, maybe you can do it without the test. Just stay away for 10 days. At least that's what the CDC is now recommending.
So I've also seen a little bit about this $5 rapid testing. How do you feel about these rapid tests? Is this something that you would encourage your patients to look into? You know,
this reminds me of that $5 sandwich. Well, this is a $5 antigen test that actually it can be completed in 15 minutes. I mean, that's terrific. Now, the one that we're talking about now just came out, was just approved 2 days ago. So it's brand new. We don't know how good it's going to be. No widespread testing quite yet. 3 others have been out for a while now, and they're pretty good. They're not as good as a PCR viral test, but they're pretty good otherwise. And so for screening, this is not a bad idea. If you have significant symptoms and need to know and that test is negative, you might want to repeat it. But the fact you can do these quickly, inexpensively, I think it'll help us to track the virus and help to prevent the spread of this virus more than we can do right now.
Now, looking at Asia, I know that there are a few countries that are experiencing reinfection, some at pretty high rates. What do we know about that right now?
Yeah, this is very concerning, Sonia. It's pretty clear now that some folks have gotten over the disease, had COVID-19, recovered, then have gotten it again. Now, you might say, well, was that just a recurrence? They've actually studied this and said, no, it's a different genetic strain of the coronavirus. So this is a brand new one they got, meaning they didn't have immunity from the coronavirus from the previous episode that they had. So how many folks are going to have long-term immunity? How many folks are not? We don't know that. The current message is if you've had it before, you can get it again. So distancing, washing your hands, wearing masks is important for somebody who's had it as it is for anyone else.
That's a good message to remember. And Dr. Winter, I did have a question from a viewer who said, when should I get my flu shot? We know that it's starting to become available for some people, depending on, your doctor's offices, your pharmacies, things like that. I know we are also coming into that window of flu, right? There's allergies still happening, and of course, COVID-19.
Yeah, this year, over any other year, it's very important that people get flu shots because the flu and COVID-19 together, that's a bad combination. It's going to fill up our hospitals if we're not careful. We'll have major problems with taking care of folks. So flu shots are very important. They take a couple weeks to kick in and 6 weeks to reach their peak effect, so you want to get it early. Now, early is usually September or October. Flu starts later in the fall, and it runs typically until March or April, and will carry through there. But yeah, I think everyone should get a flu shot if at all possible. The flu shot's supposed to be good this year. 3 strains, and there's a 4th one for some people who might want that. The 3 are the most important. So please get a flu shot at least September or by the end of October. If you wait too long, you may get bitten by the flu before you have immunity that's built up.
Yeah, we don't want that. And I always get that quadrivalent shot. I don't care what anybody says. Dr. Winter, thank you so much. I appreciate it.